Good day, everyone. I am the drug classification antiemetic agent, substance P, Neurokinin 1 receptor antagonist, and I am here today to talk to you about my autobiography. My drug classification name is antiemetic agent, substance P, Neurokinin 1 receptor antagonist. The generic names under me are limidopide, terfenadine, astemizole, cisapride, and fleabanserin. As a therapeutic drug, I am an antiemetic, and as a pharmacologic drug, I am a neurokinin 1 receptor antagonist. My pregnancy category is pregnancy risk category C.
Mechanism of action. NK1 receptor antagonists have anti-nausea and anti-vomiting properties that get relayed through a central blockade in the area post-trauma, nucleus tractus, solitarius, and visceral afferent nerves. NK1 receptor mediates most of the central and peripheral effects of substance P. Substance P is an excitatory neurotransmitter that has a role in pain perception. It is among a class of neuropeptides called neurokinins. Its receptor NK1 is a G protein coupled, consisting of 7 transmembrane helical elements. Therefore, NK1 receptor antagonists can prevent both central and peripheral stimulation of vomiting centers. NK1 receptor antagonists, such as aprepitant, oral, and IV formulations, are highly selective. NK1 receptor antagonists, which cross the blood brain barrier and occupy NK1 receptors in the brain. Animal and human positron emission tomography, or PET, studies with NK1 receptor antagonists have shown that it crosses the blood-brain barrier and occupies brain NK1 receptors. Aprepitant has no affinity for corticosteroid, serotonin, or dopamine receptors. Nausea and vomiting associated with imitogenic chemotherapy have two components: a universally acute phase experienced within 24 hours after chemotherapy and a delayed phase that affects only some patients on days 2 through 5 serotonin. Receptor antagonists are not very effective against delayed emesis. However, inhibitors of the NK1 receptors, the receptors for the neuropeptide substance P, such as aprepitant, have antiemetic effects in delayed nausea and improve the efficacy of standard antiemetic regimens in patients receiving multiple cycles of chemotherapy.
Pharmacokinetics. Absorption. After an oral dose, aprepitant bioavailability is 60 to 65%. Absorption is not affected by food and the serum half-life is 4 hours. The drug crosses the blood-brain barrier. Distribution. The volume of distribution of aprepitant is 70 liters. The mean absolute oral bioavailability of aprepitant is approximately 60 to 65%. Metabolism. NK1 receptor antagonists such as aprepitant is metabolized primarily by cytochrome P450 enzymes, including CYP3A4, with minor metabolism by CYP1A2 and CYP2C19. Researchers have identified 7 less active metabolites of aprepitant in human plasma. Excretion. After a single administration of an intravenous 100 milligram dose of radiolabeled 14C aprepitant in healthy subjects, 45% of the radioactivity was recoverable in feces and 57% in urine. There was no study conducted with a radiolabeled capsule formulation. The results of excretion after oral and intravenous administration may differ.
Indications: asthma, anxiety, arthritis, migraine, schizophrenia, glaucoma and ocular hypotension, neural injury, stroke, post-surgical nausea and vomiting, cancer chemotherapy-induced nausea and vomiting.
Contraindications. I am contraindicated with the following drugs: astemizole, cisapride, fleabanserin, limidopide, pimozide, terfenadine, ivabradine. Do not take Neurokinin 1 receptor antagonist if pregnant or planning to get pregnant or breastfeeding.
Side and adverse effects. Adverse reactions for severe hives and rash. Stevens Johnson syndrome. Adverse reactions for mild sleepiness, diarrhea, weakness, tiredness, constipation, gas, stomach pain, heartburn, nausea, hiccups, loss of appetite, headache, fever, itching, and hair loss.
Nursing responsibilities. Before I am given, the nurse should identify factors contributing to the symptoms of nausea and vomiting so that the treatment can correctly target the cause. Document the frequency and amount of emesis and effects on the patient's appetite and fluid intake. Assess for symptoms of dehydration, such as decreased blood pressure associated with tachycardia, decreased skin turgor, and decreased urine output or dark concentrated urine. If lab tests are ordered, monitor hemoglobin, hematocrit, and serum sodium levels for additional signs of dehydration. During the time I am given, the nurse should advocate for the most effective route of administration if the patient is vomiting. Consider timing of administration of antiemetics in advance of meals when appetite is affected. Follow drug label administration information and monitor the patient closely for potential side effects associated with that category of medication. After I am given, the nurse should monitor for improvement of nausea and vomiting and notify the provider if expected improvement does not occur so that other treatment can be initiated. Continue to monitor for dehydration. Teach the patient non-pharmacological interventions for nausea such as drink enough fluids to avoid dehydration, eat bland foods, stay away from spicy, fatty, or salty foods, eat smaller meals more often, avoid strong smells because they can sometimes trigger nausea and vomiting. If you are pregnant and have morning sickness, eat crackers before you get out of bed in the morning. Thank you for listening, and I hope you all have a good day.